healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Today, we're joined by special guest, Rachel Dumas. She's a nurse and also a grad student and founder of A Light After 9. She's going to join us for 2 episodes. In this first one, she's going to share her nursing journey and her personal experience with pregnancy loss. Then in the second episode, she's going to tell us how she turned her pain into a purpose-driven life. We have a lot to cover, so let's get started. If you're new here, welcome. I'm Dr. Kimberly Madison, a doctoral-prepared nurse practitioner, and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use that information to manage your health and advocate for others. It's our hope that by watching on any social media platform or listening on any of your favorite podcast apps, that you'll feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. Our other mission is to elevate the expertise of nurses, which is what Rachel will be demonstrating here with her 2 episodes. Healthcare is one of the top 10 industries in the country, and it's like number 2 when it comes to our GDP. And despite how much money we spend in healthcare, we don't have the outcomes to show for it. Nurses happen to be the largest segment of the healthcare workforce, and every day someone's entering this industry, either straight out of high school or as a second, third, or fourth career. And so we're here to share journeys so people have a point of reference so you can learn about additional professions outside of nursing and being a doctor, and just to let you know all the different ways that you can benefit from being in the industry, and also as a patient, all the different people who might make an impact on your journey. If you haven't already, this is your chance to subscribe, leave a comment or 2, and give us a thumbs up. It lets the algorithm know that this information is important, so that when people like you look for information like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Rachel, welcome to the Melanin Initiative.
Hi, Dr. Kim. How are you?
I'm so happy. Our conversation right before we started recording, we might share some of that in one of your episodes.
Absolutely.
So we have so much to cover. You have a rich history, both personally and professionally. So if you can, tell us where you're from and who you consider family.
Absolutely. My name is Rachel. I am from New Orleans, Louisiana. I live in Atlanta. Have been for almost 20 years since Hurricane Katrina ravaged New Orleans. And I consider my friends and my son and anybody in my community and my village, which has a lot of people since my pregnancy journey, my family.
Oh, we'd love to hear that. And so you said you're a nurse, right? So tell us, what inspired you to go into nursing?
Absolutely. So I went to college for film and video, actually. So nursing was not on my radar at all. I entered into Georgia State with a film and video degree in mind, and it wasn't until one of my really close friends came into my dorm room and was like, you can do all that. You don't need a degree for it, but if you need a backup, you should join me in the nursing program. I'm like, okay. But I did an internship at Emory Healthcare here in Atlanta and shadowed a nurse, and I fell in love with it. I was like, this is my calling. I don't even know what film and video is anymore. I'm supposed to be a nurse. So I started to take my nurse prerequisites, applied to nursing school, got in, and became a nurse. And during nursing school, I definitely figured out that I was a critical care nurse, and that's what I did right out of school. I went into trauma ICU.
Okay, the big guns.
Yeah.
Did you have anyone in your family that was in healthcare?
Yes, actually, my grandmother was a nurse. So she passed it along to me, and we have other nurses in the family, in-laws that are nurses. So we do have that healthcare gene somewhere in there.
And did you have any mentors in the beginning of that journey besides that nurse that you shadowed?
I did not, other than my grandmother, who doesn't talk about her nurse, who didn't talk about her nursing experience too often. So it was really all new for me outside of my other friend who was in the nursing program. Actually, two friends who were in their nursing programs at the same time. But no, it was just that internship, and that's what I went off of.
Likewise, I have a lot of people in my family that were in nursing, and that's all.
Hmm.
I mean, I just knew that they were in nursing.
Yeah,
That was kind of it, right?
right. Nothing else.
What did you see during that shadow that made you realize that that was your calling?
I saw how people had needs and depended on her, and I was in the ER, so it was life and death. We were in a trauma bay, and she was able to literally save those people's lives, and that was so exciting to me and so fulfilling to me that I was just drawn to it, and I knew like immediately that's what I wanted to do. I wanted to really save a life.
And do you work there now?
I did not work there. I haven't worked at the bedside since 2020. When I went to New York, I helped out with the pandemic in the COVID ICU and ended up getting sick. And that's when I started my entrepreneurship in nursing and started my first business actually.
Okay. And that's actually so. Before we get into your business, you are telling us not only your nursing journey, but also your personal experience with pregnancy loss, right? We have put out a call for people to come and share their experience, either personally or professionally, if they offer services. And you answered that call, and we're so
Yeah.
grateful that you did that. Do you want to shout out any of your nursing schools before we transition?
Absolutely. So I completed my prerequisites at Georgia State University, an awesome school, but then I transferred to Chamberlain University, an amazing and supportive nursing school, and just poured into me as an entrepreneur too, which we could talk about later. And then now I'm completing my master's in nursing informatics at Walden University. So all three of those schools definitely shaped my nursing career, and I love them, and they were great experiences.
Chamberlain is a very popular school.
Yes.
I think we've had several of their alumni on this podcast.
Wow, really?
Yeah. And you mentioned trauma ICU. So, in nursing, there's only like a couple units that get on a pedestal,
Yeah.
ICU and the key. And I have opinions about that I'll save for a whole nother episode. But for those aspiring clinicians who are thinking about getting in, can you just give us a little brief snippet of what to expect if you practice in that specialty?
Absolutely. First, I want to just say, do not feel obligated to go to med surge. You do not have to go to med surge out of nursing school. That is a very antiquated uh, practice and train of thought. Do the specialty that you want to do. And mine was ICU, and everybody knew it. I knew it when I was in nursing school. But in trauma ICU, specifically surgical trauma ICU, that's where I started my nursing career. There was a lot of death, unfortunately, but there was a lot of saving lives. You have to be comfortable with both to a certain extent, and you have to practice and build your boundaries because you're going to take some stuff home. It's inevitable, but you have to leave a lot at work. We did a lot of codes, so a lot of code blue, a lot of CPR. We did a lot of maintenance care. We have a lot of drugs that we're giving the patients, medications that we're giving the patients to save their lives. And we have to make sure those bags are full and they don't run out. And we have to make sure the ventilator is on a certain setting, and we're monitoring the patient and monitoring their vital signs. And it's just a lot. You have to look at the whole patient, and it's enjoyable, it's a thrill, and it's meaningful work. And you will feel like you're saving a life every time you clock into work. You're going to work for your money.
I have to be honest, I think every nurse that shows up for work every day is working for their money. I've had the
Absolutely.
pleasure of working in multiple settings, and I had that same train of thought, right? I'm not going to start in med surge. I'm going to go where I want to go, which was the ICU.
Yeah.
I started in the neuro ICU, and while I loved it, they didn't support me as an adult learner and maybe as a Black woman.
Yeah.
And so I went to my manager who also thought she should start in the ED and found out that it also wasn't actually the setting that was best for her.
Yeah.
And so I moved on. Alicia actually is a big, 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 big proponent of med surge to let people know that it's not your mama's med surge anymore. The
Yeah.
same patient that shows up in the ED, the same patient that's in the ICU, they leave those settings. No one
Mm-hmm.
gets discharged from the most 99% of people in the ICU are not getting discharged from the ICU.
Right.
The ED, they're only staying there long enough to be stable and moved to the unit.
Right.
So the same exact patients are being treated in all those settings. So if you're looking to get exposed to a lot of things, action, opportunities for autonomy and to be challenged, I promise you, if you show up for work as a nurse, you will have that opportunity
Right.
regardless of where you work. And we give so much attention to the acute care setting. I spent most of my career there, but I've had the
Mm-hmm.
opportunity to be in the long-term care setting. Those nurses tend to have to be an LPN,
Yeah.
LVN, right? You can say they have the least education formally, but they're taking care of people who are not leaving.
Right.
Some of those patients are on a vent. They are
Mm-hmm.
complete total care. They're working
Yeah.
with very few staff, very limited resources, an insurance that doesn't want to pay for anything. And so I just want to make sure those, every time I get a chance, I'm going to make sure I shout out those nurses because
Yeah.
they are working very hard, taking care of our loved ones. All of us will probably be taken care of it by them at some point, right?
Right.
So shout out to those
Yeah.
nurses. We see you and we
We
thank you so
see
much.
you.
Their work is very hard and they don't get enough attention. And we're all taking care of the same patient. And
We are.
because people in this country are so sick, the people in the ICU have to get transferred to make room for the next sick person. So
Right.
they're taking the least sick of the sickest
Right. But
and
still very sick. Still
they're
very sick.
still very sick. They're still going to need the same level of attention. But that nurse, unfortunately, doesn't have the time to give.
Mm-hmm.
But it doesn't mean the patient's needs change. They're still
Right.
going to get the same class of drugs, even though it might be a different route. So I just want to shout out all nurses. You're all working very hard, and we thank you for your commitment. It is a true calling, and that's why we take the time to share these journeys, because I just want to make sure you know what you're getting into, and that you
Mm-hmm.
see that there's people out here who may have made it, they have survived, right? Because those first 2 years are tough. Just
Yes.
like being a teacher, I think the first 5 years are the most vulnerable, the highest rates of attrition, right? And like it is
Mm-hmm.
tough. The beginning's very tough, but we're hoping through sharing journeys like the one you're going to hear today gives you hope that if you have the right support, mentorship,
Yes.
you just be patient and speak up for yourself. You do have to speak up for yourself. It can be a wonderful career, a long-lasting career, and you can turn what you learn by taking care of patients into a business
Right.
or or a ministry, whatever you want to do. It doesn't have
Mm-hmm.
to stop at the bedside. That's the main thing we want to emphasize. You are
Right.
more than a nurse.
Absolutely, 100%. And when 2020, when the pandemic in 2020 started, I've never seen so many nurses just trying to run from the bedside. And it's not that they even tried to run from the bedside, but it was that they wanted to not be a nurse anymore. And I was just thinking, there's so many things we could do as a nurse. We don't have to, leave the profession completely. There's so many facets, so many different specialties. I think we were, as a community, exhausted
Mm,
during that time, reasonably so.
yeah. And that's why I love your journey, right? Because it started off in informatics. My journey started off in
Yeah.
IT, and here you went into nursing and now you're circling back. So now you're in informatics, right?
Hmm.
Can you tell us what that is?
Yeah, absolutely. So, nursing informatics or clinical informatics, which is what I'm getting my master's degree in and eventually my doctorate degree in, is that cross between IT, information technology, and clinical practice. So, IT, and not all IT people who are in IT, they don't always know everything that a clinician needs as far as documentation, workflow. So, it became such a big issue and such a big need that informatics became so popular. It's still a growing specialty in nursing. However, we realized that we need IT, but we need somebody on the clinical side to say, this is how we need to use information technology. So here we are, nursing informatics or clinical informatics developed.
I love it. Our job could not be done without tech,
It
right? I mean,
can.
we've all had those downtime forms, right? And
Yeah.
pray and look
Yes.
at the clock and wait for that period to be over.
Yes. Yes.
But yeah, we literally, I won't say we couldn't do our job without it, but it would be really difficult, right?
Right.
Um, and I think if you're new to the profession, you don't realize how much tech there really is.
Right.
And unfortunately, when, like you just said, creators come up with these ideas and they're in the ideation phase, we're not being brought in. So they come up with these beautiful devices. They
Yes.
work really nicely, but they just don't fit into our workflow. And
Right.
they have the nurse coming in after it's been through R&D. You've put
Mm-hmm.
out millions of models, and now it's on the floor. And what happens is the nurse creates a workaround. A
Yep.
workaround means we're not utilizing it the way the creator envisioned. We're using it in a different way so that we can
Yes.
get our job done.
Yes.
And so we're encouraging creators out there to have us be part of that conversation so that you create devices that actually work. And you might even spend less time and less money and then get less customer calls.
Right. And you will even see technically not, well, outside the hospital, those companies who create these devices are now hiring nursing informatics or clinical informaticists to help facilitate that process in pre-production because it's so important. They're realizing that the hospital is calling nonstop because, like you said, all of these workarounds, we're not using it properly. And that can even be dangerous for a patient depending on what the device is. So it's so important, this specialty, um, that, it's becoming widespread, even definitely outside the hospital now.
I hope our listeners are hearing whether they're already in practice and maybe they're looking to transition and pivot to something else, or they're entering and they're like, where do I go? Or they're like, they're not even considering it because they don't like patients or blood, but they just heard you like, oh, I can do tech and nursing and maybe not, be taking care of patients and cleaning them up and blood and all that other stuff that I hear other people
Yes.
talk about. It's kind of exciting, right? Yeah, so I love that. So where does your love for informatics and maternal health meet?
So I started with informatics at an outpatient surgery center who was doing paper charting, and it bothered me to my core. So I implemented the electronic charting system for them. And that's how I got into informatics. Now, I got into maternity, and I know that's far fetched from trauma, ICU where I was, and pre op and OR where I was as well, because of my pregnancy journey. So, starting in 2018, I had my first pregnancy loss very early at 6 weeks. Went to the OB after discovering that I was pregnant with an at home test. And I was told that I was losing a baby, but I was also told by the OBGYN that this is a normal part of pregnancy and that you're going and have a healthy baby and a healthy journey, which was far from the truth. You know, my pregnancy journey was not smooth and seamless as he made it sound. So fast forward to 2020, after the pandemic, after I came home from my travel assignment in New York, I found out I was pregnant again, this time with twins. That was a very rough pregnancy for me. I was in pain every day. I was bleeding, and I just thought I was going to lose both babies. At 13 weeks and 5 days, I lost the first baby and was told I had vanishing twin syndrome. So the baby that was still alive absorbed that other baby. 15 weeks, all my symptoms resolved. I was feeling like a great, healthy, pregnant person, great enough to allow my friends to plan my gender reveal. At my gender reveal, I went to use the bathroom, and the baby fell out in the toilet. At that point, I went to the hospital and then followed up with my OB, and she diagnosed me with cervical insufficiency. I had a series of early miscarriages at that point. Ended up seeing multiple specialists, reproductive geneticists, reproductive endocrinologists, maternal fetal specialists once I was pregnant. And in 2021, I was pregnant long enough to get what's called a transvaginal cerclage, which is the treatment for cervical insufficiency. This is when a suture is placed around the cervix so the cervix won't open up. Because in my case, when the baby got heavy enough, typically at the beginning of the second trimester, the baby will fall out because my cervix was weak. So fast forward to 13 weeks, I got the cerclage placed. 20 weeks, the cerclage failed. And I was told to go to uh, the OBER and just go and deliver my baby. I asked the doctor when the baby passed, and she said yes. I asked if we can put another cerclage in or do something or be on bed rest. She told me no. So I did a lot of research. My village did all the research they could, and we found a doctor in Dallas who had placed that transabdominal cerclage, which is higher than the vaginal cerclage, during a 20-week pregnancy for twins. Now I only had one baby, so I was very hopeful. We called his office. He texted me. He said, "Fly to Dallas, try to make it here if you can, and we'll try our best to save your baby." I flew to Dallas. He did the surgery. Surgery went well. I woke up to a bunch of healthcare professionals cheering around me, saying, "You're still pregnant. We did it." Unfortunately, after anesthesia wore off, I started to have contractions, and I went into labor for 30 hours, despite of all the tocolytics given to me to stop contractions and every medication they could. My bag burst, my water bag burst, and I had to go back to the OR and deliver that baby. After that, that was loss number 6 or 7. I had a series of other losses. That doctor promised me that he would bring me back to Dallas to get another surgery, a transabdominal cerclage placed in outside of pregnancy. True to his word, that November, he brought me back to Dallas, paid for the whole surgery, got it done, and he said, "Rochelle, I know you've heard this before, but you will have your baby after this." And I didn't believe anybody except him. I really believed him that time. So the next year, I had a early miscarriage and another one that same year too. But May 2022, I found out I was pregnant. I saw the reproductive endocrinologist during the first trimester. I graduated to the maternal fetal specialist. And after 4 years and 9 pregnancy losses, I finally had my baby, Nazaire, on 12/30/2022. So that is how I segued into maternity care from informatics.
Well, we are really happy that your journey ended the way that it did. We know that that experience doesn't, it's not forgotten, right? The memories, the pain, emotional, physical, mental. And we're just so grateful that through God, you've been able to come up with a way to channel that. And we can't wait to hear more about that. And we just thank you for sharing your testimony. For some people, it's going to be a sign of hope, and for some people, it might be triggering. That's a real thing. And you're part of a series that we've started on bringing awareness to Black maternal health outcomes here in America. I started this show by talking about how we spend a lot of money here in America, but unfortunately, we don't have the outcomes to show for all those expenses. And the numbers are really dire when we start talking about Black women, pregnancy, and loss. We have dedicated a few episodes to the issue, starting with Dr. Camilla Barnes, who told us about the Black Maternal Health Virtual Conference at the top of the year through the National Black Nurses Association. We have Charity Bean, who's the founder of the Doula Lab. We have Tiffany Lewis English, who came on and told us about all her personal journey with infertility, and that motivated her to start Hannah's Heart. And she taught us about October 15th at 7 p.m., when people spend that hour recognizing pregnancy loss and they light a candle. And I've been so inspired by all of you who are so committed to making a difference in the Black maternal health space. I always say that if I didn't already know what I wanted to do, I would probably join you guys. And that's why I love to dedicate episodes and bring attention to it. And that the work will continue, right? And we're just hoping that we know that the work you're doing and everyone else that I mentioned in the whole community is helping to bring awareness to it, and how important it is that we don't take these journeys by ourselves.
Right, right.
Yeah.
Thank you so much for that. And you still could join us.
Yeah.
You could join us.
I have some ideas naturally. And so you said 9 pregnancy losses, 5
Yes.
surgeries, right? And so surgery's physical, right? Tell us
Mhm.
about the mental health impact on this at that time and how you're doing today.
I was diagnosed with depression, anxiety, and PTSD, to be transparent, and reasonably so. You know, my mental health was poor at a lot of points in this journey. I started talk therapy, which I've been in therapy most of my life because of childhood trauma that I had, but I restarted it in 2021 after that major loss, that 20-week loss that I flew to Dallas to try to save. It just took a really bad toll on me. And that really helped. And in 2022, I even tried hypnotherapy because I had finally gotten a procedure that needed to be done outside of pregnancy. And I still wanted my baby and I still wanted to try, but something in me wouldn't let me. But hypnotherapy changed that. And I'm forever grateful to my hypnotherapist. But my mental health it just took a toll on my mental health. And if I could go back in time, I would have started therapy early. And the mental health issues that I had carried over into my birth. The labor was the easiest part, like, of my pregnancy journey. Once I was having my baby and in the OR, but I still did not believe that I was having a baby when he was being born. And he went to the NICU, and I still didn't believe I had a baby in the NICU, but I was going to see him every hour or however often. And when I went home, I still wasn't claiming him as my own because I thought that he would leave me. So for a month, I didn't bond with my baby. I was his nurse, and he was my patient for a month. I did everything I had to do to keep him alive, and even more than that, of course. But I never called him my baby. He was always the baby until a month later, until I was like, he's not going anywhere. He's mine. So that mental health toll it's crazy. So I'm still in counseling. I still talk about it. Grief is, you know, you have your moments, but I'm doing way better, doing much better.
Oh, we're glad to hear it. Curious, what motivated you to resume therapy?
I felt like I was just so depressed that I just didn't feel safe anymore.
Mm.
And I knew I needed help. And I had been there before. Like I said, I've had previous trauma. So it was almost natural just to restart therapy. And I already had a therapist in mind, and she was more than happy to take me. So I just want to be healthier. And I know I wasn't.
And then how has pregnancy loss influenced your perspective when it comes to nursing?
I look at nursing completely different now because you don't really know how motherhood shapes you until you become a mother or a birther. And being on the other side, like being a nurse to a patient, we don't really know like what they're coming to the hospital with completely, right? You don't know if they just gave birth or postpartum or just had a loss. So because of that, I look at patients differently now, more holistically even. So.
And you brought up a really important phase of pregnancy that I know the community is doing a lot to bring awareness to, but the public still might not be as aware. And we hear this all the time, especially from young women who are getting pregnant and don't have the village or a community to support them. So much of the emphasis and prep is going into labor, which is but a moment, right? And we have parenting, which is forever. And then we have the fourth trimester. So
Mm-hmm.
many women have taken to social media to talk about their shock about their
Yes.
experience during the fourth trimester, uh, physical
Mm-hmm.
symptoms, right? But also the mental part, and it changes your whole perspective on how you see the world. how you feel about people touching your body,
Yes.
looking at your body, and definitely that postpartum depression. And
Yes.
actually, no, you listening to you talk, we haven't done an episode on that yet, so we will have to do that
Yeah.
because it is it's a hard time. And yes, I love that you brought the fact up that that first month you did not have that bond that seemed that I think the norm is that, oh, it's going to happen automatically as soon as you
Yes.
have a baby because you're a good mom.
Yes.
And if you don't have that bond with your baby, you're not a good mom.
Yes.
And that could be so far from the truth.
Yeah. I was so concerned about that because people even told me that it starts when you're pregnant. And I didn't feel it. I was like, this baby is not even my baby, first of all. I don't even know if I'm going to see this baby. So it was definitely no bonding during the pregnancy time. I was keeping myself safe and made sure nothing happened to him. But I did not feel that connection that everybody talks about. When he was born, I looked at him, I embraced him, but I still didn't feel it because I just knew something was going to happen and he was going to be taken away from me. So I think we have to get away from telling women, oh my God, when you have that baby, it's just going to be that instant connection, because then you start to internalize that. When it doesn't happen, you feel guilty. You feel like a bad mom. You feel all these things that during that very vulnerable time in your life, such as giving birth, you don't need to feel any of those things. And you deserve to be able to tell your truth that you didn't feel like that, and be able to move forward and work on those things, because it's work to build that bond. I really had to continue therapy and not force, but like practice bonding with my baby until it felt natural.
And it sounds like you had a good relationship with that doctor in Dallas.
Yes.
But I'm curious, are there any other areas of your care where you feel like there were gaps that could have been addressed?
Oh, absolutely. So when the cerclage failed during my 6 or 7 pregnancy, I lose count sometimes, but when my cerclage failed and the ultrasound tech just ran out the room, and the doctor who did the cerclage came in and just told me, you can go upstairs and deliver. She said it so matter of factly, like my baby wasn't about to die. That moment sticks in my head, and sometimes it just gets stuck on repeat. And I hate that for myself, because that alone is like one of the big reasons why I have PTSD. It's just like that experience and the way she said it and how she treated me when I was so desperate. And I have pride. I was literally begging this woman to please like do anything to help me, and she was just like, no. Those bedside manners just really shaped my pregnancy journey and my mental health even. It took a really big toll on my mental health. And because I couldn't find a doctor in Atlanta to place the abdominal cerclage on top of that cerclage, which is a big city, we have so many different hospitals here. It's no way I should have had to go to Dallas to have a doctor do that, or Florida, which was going to be my other options. Mm-hmm. So I had an issue with healthcare access during a very crucial time. I could have gave birth on a plane, so that would have been even more traumatic and unsafe for me. So in order to receive care, I risked my life and the baby to go to another state to get a surgery done that could have been done in my hometown.
Well, let me say, I'm sorry that happened to you. You didn't deserve that kind of treatment. No one does. And hopefully, I think it's evident that you don't think everyone in healthcare is like that, right?
Absolutely not.
And we want to encourage the viewers and the audience listening that even if you have a bad experience, a really bad experience in healthcare, please don't give up on the other people who are in the field, because there are a lot of us out here, just like Rochelle, who really do care, who really do understand and empathize. They've been in your shoes. And it's just a matter of speaking up for yourself, like we try to emphasize all the time. And if you feel like there's something wrong with your body, keep looking for the right answer.
Yes, yes. I've come across many great doctors like Dr. Coworker in Dallas, but also my reproductive endocrinologist and the reproductive geneticist and my OB. So it's more doctors that I came across that were amazing than those that I came across and had a bad experience.
And we're so glad you didn't give up, right? Because especially in our community, we have historical trauma, right? And that's
Mm-hmm.
prevented us, a lot of us, from getting the care that we need sooner than we should. And then when we do enter, there's a lot of fear and trauma associated and lack of trust, right? The healthcare, it's a relationship based on trust.
Yes.
And so we're so glad that you've been able to share your testimony, which was filled with a lot of pain, but also triumph, and
Yes.
it's really nice to see. And so now that you've had all these experiences, personally and professionally, what advice would you give other healthcare professionals caring for families that find themselves in the position that you did? And even now, right? Because you're still, managing that.
Yeah, I'm still managing to look at the patient holistically. Also, I would love for healthcare professionals and hospital administrators and hospitals to really change the way we're looking at maternal care and maternal trauma care, such as those experiencing loss or going through certain fertility treatments, and to implement palliative care. I think that is a very underused, or not used at all, specialty that definitely needs to be implemented in times of maternal trauma. We need that hand holding, and then we need that case management hand holding well after the hospital, because so many of my losses occurred outside the hospital. And even as a healthcare professional and a nurse and knowledgeable person, within the healthcare profession, I did not know about this specialty. A lot of people think, oh, you're a nurse, you know everything in healthcare. That is not the truth. I don't know anything about pediatric specialty or maternal health at the time. So I needed that advocacy, that hand holding to make my journey as comfortable as possible. And I deserve that. So I encourage other healthcare professionals to also implement those things too.
And we're going to do a deep dive into your framework in your next episode because it deserves that attention. It's a beautiful vision. And so we're so grateful, and we encourage you all to come back and watch that episode. Make sure you subscribe so you'll be notified when it airs. As we close out, I'm curious about a few things. Now that you are where you are, is there anything you would have done differently?
I would have started therapy early. I would have advocated for myself to get more testing earlier and sooner so we can rule out other causes of miscarriage and stillbirth earlier in that journey, instead of letting the doctor say, oh, you'll be fine. Just so we can say, okay, it's not any of these things. We can focus on other issues that may be causing these miscarriages. And I would have advocated for palliative care throughout my journey because I needed it.
And what does advocacy look like? Someone's listening and they're thinking, oh, that's me. I relate to that. How do I advocate for myself?
I would do more research early on, and I would look at peer review articles, credible articles, and look at those articles that are like your story and take them to your doctor and say, hey, they're doing this. I saw this. And speak up for yourself with confidence. Bring that research. And if you're not comfortable with your local team and the way they're treating you, we are practicing medicine, and it's just that, move on to another team and advocate for yourself in that way.
Yeah, we've had 3 doulas on the show, and they've taught us about the different skills that doulas bring to the table. And we know that they're actually postpartum doulas. And so
Mm-hmm.
depending on where you are in your journey, you might be able to find that additional support to help advocate for you,
Yeah.
identify those credible resources, identify uh, people on your team who you can go to for second and third opinions. And so we do want to make sure you know everyone who's available to assist you. And I think someone told us about like a fertility therapist even, right?
Mm-hmm.
Yeah. So so many resources out there.
So many.
Where should someone start if they want to take that journey?
Yeah, so my business is called Light After Nine, and I named it that because after 9 losses, I finally found my light, which is my son. And we have so many resources for mental health, for grants, because it's expensive to have so many losses and to go through the fertility journey. We find doctors and specialists, which I definitely needed throughout my journey, that can be tailored to your specific issues and needs. We are collaborating with other maternal health organizations to help spread these resources and help bring in their resources. So if you need a doula, a postpartum doula, a therapist, or a hypnotherapist, or whatever you may need, a reproductive endocrinologist, we're able to pull out of those databases and make sure we deliver those specialties and resources to you as you need it. So please come on our website, and please do not hesitate to reach out.
And we'll have all her information in the description box, so you can contact her and visit her website. In her next episode, we're going to do a deep dive into what it's like at her business, what you can expect by being a client, and hear more about this framework when it comes to palliative maternal care, and the big vision that she has for the future. Thank you again, Rochelle. Do you have any other closing remarks you want to say?
I'll save them for the next episode.
Okay. Well, yes, thank you so much for coming on and sharing, being so vulnerable, first of all.
Thank you so much.
You can tell that story in 1 minute if you wanted to, right? But you've been very kind to be very vulnerable and transparent about that. And, sometimes these stories, they can be even harder to tell when you're supposed to be an expert, right? You just told us you don't know everything that in healthcare. And I think the public doesn't always get that.
Yeah.
Especially, I think doctors probably get it the worst, that people expect them to know everything. And that's just simply not the case, especially when you do interspecialty. I mean, you really become a specialist in that particular organ or body system. The other things, I know as much about it as that person asking you questions. And so that's why we love to bring on people like you to identify the importance of understanding who's on your team, and why it's still important to have that primary care support in the back to support your whole care coordination. Again, we thank you for your vulnerability. We're so glad that your story ended up the way that it has. And we look forward to bringing you back on to hear the other side of this journey and where you want to go. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, this is your chance to subscribe, leave a comment, give us a thumbs up. We really appreciate it if you take the time to rate us on Apple and Spotify. When you leave comments and you follow, you like, you share, it lets the algorithm know that this information is important, so that when people like you look for information like this, we show up higher in their search results. You can find all the links that we mentioned today, how to connect with our guests, how to connect with us, in the description box. At the time of this filming, we release new episodes weekly on Sundays at noon Eastern on YouTube, LinkedIn, Facebook, Instagram. Shout out to Angie. And we drop the audio at 5 a.m. so that our night shifters can be the first to get something and not the last. Our day shifters have something to listen to on the way in, and maybe someone will play it during huddle and let us know all about it. We thank you so much for watching, and we'll see you next time.
I'm Alicia from the Melanin Initiative Podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.